So the biomarker analysis was actually accompanying the COMMANDS trial, the latter being a randomized study comparing luspatercept with Epo alpha in patients with transfusion-dependent lower-risk MDS. The trial was positive with regards to the primary endpoint being transfusion independence, and therefore also this luspatercept agent was recently approved also as a first-line therapy for low-risk MDS patients. So the biomarker analysis analyzed the mutational pattern at the very beginning, so at screening, and correlated this with the clinical outcome and the response rate, but also patterns of inflammation and other markers, biomarkers, and correlated these with response. So to make a long story short, in the subgroup of ring sideroblastic patients, the predominant mutation, of course, was the SF3B1 mutation, the latter being almost absent in patients with ring sideroblastic negative phenotype. Within the RS positive segment, actually, within all mutational subtypes, luspatercept was favored with regards to a response rate. In the RS negative subgroup, actually, both treatments yielded comparable results within a mutational subgroup of patients. On top of that, the data also showed that compared to baseline, luspatercept modulated different inflammatory pathways. Also TGF-beta pathway was significantly modulated compared to ESA EPO-based therapy, again highlighting the fact that luspatercept is not just another EPO, it is significantly altering also pathways of inflammation, including a TGF-beta pathway, which I think is an important also readout of this study. Last but not least, and a little bit surprising, was the fact that pro-BNP levels were significantly altered, predominantly in the luspatercept treated patients. Interestingly, pro-BNP levels in the EPO arm actually went up in, for instance, non-responders, but were significantly downregulated in patients undergoing luspatercept therapy, suggesting that luspatercept, beyond its activity on hematopoiesis, may also modulate or improve heart function in these elderly low-risk MDS patient population with transfusion dependence. Again, this on the long-term run could argue also for a potential additional benefit of luspatercept therapy. So taken together, the data shed some light on the mode of action of luspatercept, how the drug improves hematopoiesis, but also other organ functions.